Jo-Vivian, and today I will just be discussing about my case study that I have done. The source of the data comes from the Centers for Medicare and Medicaid Services, which is a free site that allows individuals to go on and to discover new measurements from different hospitals in the United States. I specifically looked at a source of data that provides information about patient satisfaction, which is called the Hospital Consumer Assessment of Healthcare Providers and Systems Patient Survey. These are collected on a yearly basis, but it is refreshed quarterly. And I used the data from 2014 to this year of 2021. And so these are the different measurements that I have decided to use. The first one that I used was the patients who reported that they were given information about what to do during their recovery, patients who agreed they understood their care when they left the hospital, patients who recommends a hospital, patients who report that the staff explained about medication before giving it to them, and patients who did report that they received written information about possible symptoms to look out for after discharge. These measurements are very important because these all associate with the percentage of readmissions. So determining these will also give an idea of whether people are coming back due to malpractice or if they as in the doctors and nurses aren't providing enough quality of service for them as in the patients to take care of themselves. So if the readmission rates are low, more patients will trust the hospital with their quality of care. And so the hospital that I have chosen to review is the Mary Immaculate Hospital, which is in Newport News, Virginia. There are different ratings on the different rating websites. So for example, for Google, it has 2.9 with 200 reviews. On Yelp, it's 2 stars with 3 reviews. And then on CMS, which is the Center of Medicare and Medicaid Services, it has an overall rating of 5 with a patient survey rating of 3 out of 5. And so I compared this hospital's competition to 3 hospitals that are in the area. So the first one was the Centera OBICI Hospital, which is in Suffolk, Virginia, the Riverside Regional Medical Care, which is in Newport News, Virginia, and Chesapeake General Hospital, which is also in Chesapeake, Virginia. I chose these hospitals because I was curious about the different area of Virginia and the quality of service and care that they provide, and determining how those hospitals in Northern Virginia can improve based on what has been done in the Virginia Beach area, or is further south. And so the only limitation that has been received is unavailable data from specific years, and you will see this later on, but one of the hardest things was using the correct patient satisfaction measurements that I wanted to use to determine how different hospitals are doing. But I wasn't able to do that, but I did end up finding better alternatives for that. And so the first control chart indicator was the measurement of patients who reported that they were given information about what to do during recovery. So compared to hospitals, most patients agree that they are given information prior to discharge, but you do see that in 2020 it does decrease, but it stays within the control limit. But this also means that it caused possible dissatisfaction. In the second control chart, it measures patients who understood their care when they left the hospital. And so compared to other hospitals, the Mary Immaculate stays in control besides in 2017 where it goes under the lower control limit. This could indicate that there were an increased amount of dissatisfaction on not understanding their care after discharge, and this could be something that the hospital looks at to determine what exactly happened and what occurred that they noticed to improve, because it does improve later on between 2017 and 2021. In the third control chart that I use, it measures the patients who reported that they would definitely recommend the hospital, between 2014 to 2021, it stays between the lower control limit and the upper control limit, meaning there is control and that there is constant satisfaction between that. The fourth control chart that I did was to measure or to compare the patients who reported that the staff explained to the medications before giving it to them. And so between 2014 and 2021, Mary Immaculate stays between the lower control limit and upper control limit, meaning there is control and that there is satisfaction with that and that patients are receiving the information that they deserve to understand what medications are taking. And the fifth control chart indicator is to measure the patients reported that they did receive written information about possible symptoms to look out for after discharge. Unfortunately, there was only 3 years of information, but that still is enough for us to compare it to other hospitals. So comparing it to other hospitals, Mary Immaculate goes above the upper control limit in 2021 and under the control limit in 2021. And so this can indicate that there is no constant satisfaction that patients are receiving between 2020 and 2021, and that could be because of really big life changes. This could also be because of the pandemic of COVID-19, which could have caused this occurrence to happen, which makes such a big extreme. But definitely this is something that the hospital should keep in mind, that when discharging patients, they should be continuously giving written information about possible symptoms so that patients can look after that. Of this, that what we've learned throughout the different control charts is that COVID could have definitely affected how the hospital's workflow has been and created a lot of different traffic, which could involve it affecting patient satisfaction with so many people coming in and out of the hospital, and with minimal amount of doctors and nurses, this could have definitely affected the satisfaction and for it to be decreased. Improvements needed includes ensuring patients really understand their discharge care, because that is very critical when it comes to the patient going back to their everyday life. A suggestion for this is to create a safer environment for patients to ask questions to nurses and doctors without feeling threatened or without feeling that they're being a bother, and also solidifying patient care quality. Thank you so much.